I think it's worth traveling to Korea for treatments that you cannot get here or wherever you live. That's FDA approved in Korea, right?
The Western mentality.
Yeah.
Like, I don't want to do this consistently. I want to just go in, bang it out, and then have these amazing results. But in Korean culture, it's about the slow consistency of it. That's one of the things that I feel very drawn to with Korea. It's just the level of innovation.
But also, just to be clear, like, just because something is new, it doesn't mean it's better, right? Sometimes it's better to just kind of wait and see how it responds and then jump on the trend.
In 2020, that Hong Kong billionaire heiress went to Korea to have liposuction and breast implants done. And during the liposuction procedure, she passed away.
Oh my gosh.
There wasn't an anesthesiologist there. And the procedure being done was by an orthopedic specialist and not a plastic surgeon.
Oh, wow.
Listeners definitely need to know when they're going to Korea, hey, if you're offered deep sedation, the best way to stay safe is to ask, is there an anesthesiologist
100%.
who's going to be there the entire time?
Welcome to Mirror Mirror with me, your host, Amy Chang. This is where we look at beauty on the surface and everything beneath it, from the cutting edge science shaping the industry to the cultural and societal forces behind how we see ourselves. Each week, I'm joined by experts for deep dives alongside unfiltered friend of a friend conversations that tell the full story. Expect insight, raw honesty, and the beauty intelligence you've been searching for, the kind that lets you love beauty while still questioning it. On today's expert deep dive, we explore beauty getaway. Is traveling to Korea worth it? With Dr. David Kim, a board-certified New York City dermatologist with a Stanford medical degree, a master's in public health nutrition from Columbia, and experience at Harvard T.H. Chan School of Public Health. Dr. Kim travels to Korea annually to stay on top of the latest products, aesthetics, and today we dive into what's new in Korea, what's worth the trip, and what's better left for at home when it comes to treatments and procedures.
Remind me how old you are?
I'm going to be 39 in March.
Okay.
Why?
No, you're so young.
Am I? How
You
old are
look so young.
Do I? That's the highest compliment.
No, you do. Oh my gosh.
Great. Thank you.
Oh my God. 39. Oh,
Yeah.
Okay.
Thank you. I'll take it.
That's a big birthday.
I know we're not supposed to
Talk about age?
Yeah, like ageism.
Yeah.
We're not supposed to worship youth and all of that. But it's a great compliment. So thank you, Doctor.
But do you feel like a 39-year-old?
Yes.
I don't even know what that means. Like, how are you supposed to feel when you're 39?
I feel like I have a lot of life experience.
Yeah.
I went through some shit.
Yeah, okay.
And came out the other side. And so that makes me feel old because I feel like I have bits of wisdom from those experiences. Yeah, I do. I mean, I do feel my age, but I don't mind that. I don't want to feel 20 or 25. I want to feel 39.
Your age? Yeah.
Yeah, because I'm very happy being 39.
Yeah.
And I was a hot mess at 20 and 25.
That's hard to believe, no? I want to know what a hot mess Amy
Thank
was
God
like.
there was an iPhone, there was a phone. Like, I'd be in jail. Part of the reason I moved to New York was because my parents were moving here. My dad took a job in the city.
Okay.
And they were like, we can't leave our fuck up daughter in Minnesota. Like, she's going to end up in a ditch somewhere.
Oh my God.
My sister had just gotten married to her high school sweetheart, which is what people do in Minnesota.
Okay.
A lot of them.
Yeah.
Which is nothing wrong with that, but it was not something that felt right for me.
Yeah.
Anyway, and so there was that whole era of that, and thank God there's no photo evidence of it.
So glad
I think when we were growing up. Wow, that's
how old are you?
Almost 42.
Oh, okay.
Yeah. Turning 42 in like a month, 2
You look
months.
very youthful.
I don't know. I don't feel like a 42-year-old.
What do you feel like inside?
Maybe like early 30s. But I do feel like I've gone through a lot too. So I feel like, I guess this is what you're supposed to feel like when you're in your 40s. I feel much calmer and I feel much more confident about the decisions that I make and then like the things that I pursue. And I feel like I have a really good understanding of like what I want, who I am and where I want to be. So I guess in that way, I feel really mature and like very clear in terms of just like, what I thought a 42-year-old would feel like. This is not.
Oh, yeah.
But I thought,
I mean, I remember
I feel like a kid.
So I was like, that's ancient.
Yeah, I know exactly. Yeah.
And now I feel like this is when life begins.
Yeah, I know.
Because you got adult money.
Yeah.
You have a good head on your shoulders. and the world is your oyster, right?
And you know that you have the freedom to do whatever you want. Yeah.
Yeah.
It's entirely up to you.
Exactly. Yeah. So cheers to 40.
Cheers to 40s. Oh my God.
Yeah, but I will be soon.
Are you going to throw a big 40th birthday party?
I don't think so.
You don't think so? No. You may change your mind.
Maybe. Yeah. I think I'll do like a trip.
Okay.
Maybe like a couple close friends.
Yeah.
Husband and my kids too.
That'd be so nice.
Yeah, something chill. I don't drink alcohol anymore. And I'm like in bed with a cup of tea at 9 p.m.
Oh
like
my gosh.
20-year-old me would not even recognize me, like at raves and like dropping E and being crazy.
Oh my gosh.
Okay, we have to like cut that.
We're not doing that.
Although I have talked about it on social media,
It's fine. Yeah,
it's fine.
Okay.
So I'm so happy to have you here.
I'm so excited to be here.
Because you go to Korea every single year.
Yeah.
And we need to talk about all the things. We need to talk about like what's happening with the innovations. But first, let's just start off with, why do you go to Korea every year?
I grew up in Korea. I grew up in Korea until I was 14, and then I moved to Toronto. And then since then, I've always gone back at least once or twice a year because I still have family there. I used to go see my grandma every year, who is no longer with us.
Oh, good Korean boy.
No, but I used to like live right next door to her, so I used to see her all the time. I basically grew up with her, so it was just like going home. And it's really interesting. I think when I first moved to Toronto, I was trying really hard to learn English. I was in ESL for 4 or 5 years and trying to fit into the Western culture. And I didn't try to stay away from Korean culture, but I was really focused on trying to fit in, assimilate, that I really never really thought about what it meant to be Korean until really like the past, I would say 10 years, until I became an adult and I realized how Korean I am and how much I love Korean culture.
What's the most Korean thing about you?
Oh my God, I need to have a jar of kimchi in my fridge at all times.
Okay.
That's really, really Korean.
Do you make it at home?
I want to learn. My mom's an amazing cook, so I'm going to try to learn this Christmas when I go home.
Send me that recipe.
I will.
Yeah.
But there's so many steps, You got to blend this in, blend this. Like my mom is so... she loves whole foods. Like she doesn't like using too many ingredients or processed foods. So instead of sugar, she will use pear or kiwi or like a blend of the two.
Love that.
And it's actually so much better that way. It actually ferments a lot better too. But anyways, so I just love going back to Korea just because I know it's like going back to your roots. I feel so comfortable and at home. And I always come back feeling really full. And I always feel like, I'm just like not floating in this universe. I have a whole family that I can stand on top of, who's supporting me and cheering me on. And it kind of reminds you that you're not alone. And I love that feeling.
Yeah, the past few times that I've gone to Korea, because I went to Korea when I was younger.
Yeah.
I'm adopted. My parents took me to Korea multiple times as a kid and then in, adolescence because they really wanted my sister and I, she's also Korean adopted, to know our heritage. But when I went at that period in my life, I felt like an other. I felt like I didn't fit. There was this disconnect. I was like, I don't really understand Korea. I don't understand Seoul and the culture. And I also felt like I didn't understand myself at that period of time. So there was this disconnect. But the last few times I went to Korea, I was like, I'm home. I'm back. I've come back to the Mecca. A big piece of it is feeling like I was welcomed by the Korean people.
Okay.
And I think part of it, right or wrong, is attributed to the fact that when I was younger, I was really tan.
Okay.
I had blonde hair.
Oh my gosh. Okay.
And because I was trying to assimilate to Minnesota and the people and the culture there.
Yeah.
And now I've really embraced my own natural beauty. I have a very strong sense of who I am.
Yeah.
I love being Asian.
Yeah.
And I'm sure there's a piece of that was felt.
Yeah.
And so when I went back to Korea, I was like, these are my people. This is where, everyone's got the hat and the umbrellas. And I was like, yes, my
felt
people.
It. Yeah, I love it. It's a great feeling, right? When you feel like you're at home and you don't have to explain things and things just make sense. And then you have a group of people who also feel the same way. And you're like, oh, this is cool. Yeah. Yes. I don't have to feel like an outsider. I'm like part of the majority in a way.
Yes.
Yeah.
There's definitely that element to the culture of this group think and like group mentality with it, which on the one hand is really lovely because people coalesce around each other and like there's this whole like family and community support. But then on the other end, you tell me if this is true, but I've heard this from my Korean friends who live in Korea, that if one deviates from that group mindset, then they're punished, they're ostracized.
It's true. It is really hard to stand out there. You're not encouraged to stand out. You're encouraged to fit in. It's a very homogenous community, right? And country. So if you go there and if you follow the Korean culture, you can tell that right away, like if there's one trend, it blows up and everyone's doing the same thing. Everyone buys the same thing. Everyone eats the same thing. Everyone's dressed the same way. Because it's a very trend-heavy culture, and you are encouraged to be aware of your surroundings, your community, and fit in. Don't try to inconvenience other people. So if you're too loud, if you're too opinionated, if you have very strong opinions that's against the norm, then you are frowned upon. So it's really hard to kind of discover yourself because you're always focused on your community more than before you think about yourself, which I think in a lot of ways is actually really beautiful. And it's pretty rare because it teaches you to be considerate, thoughtful, and not so self-indulgent. And it makes you aware of how your behavior, your words affect other people. But also it takes away from the ability to really learn about yourself and what makes you different and unique, which is so highly emphasized here in the US, right? So it's like there's a big dichotomy there.
Yeah. And I mean, to your point about it being a homogenous society versus here in the US, we have a heterogeneous society. And so like, because of that, the people in the US want to celebrate those differences. Whereas in Korea, it's about celebrating how we are all similar.
Yeah, exactly.
What stood out to me the most when I was there recently was that I was like, how come everyone's wearing black, white, beige, like neutral colors?
Neutral colors,
I was like, is it just that everyone's into this like mid-century modern, like very minimalist style
simple,
of dressing, like the row kind of vibes, right?
Yeah.
And then my girlfriend was like, no, in the corporate space or in work settings, it's frowned upon to wear bright colors.
Oh, is that right?
She was like, it's this unsaid that you wear beige, brown, these very, these neutral tones so that you are a part of the collective.
Yeah. That makes sense. And also maybe you don't want to draw too much attention to yourself. You just want to kind of fit in, blend in. But it's so interesting. Like people have really good styles. And like a lot of people talk about K-beauty, but like K-fashion is like a real thing. And there are certain brands that you will discover along the way and you can't believe that this is like a Korean brand. There's so many of those.
I need a list.
There's a brand called Recto. Have you heard of Recto?
No. I mean, I have not dived into Korean fashion. I need to because I've been so heavy on Korean clinics and beauty.
Yeah.
But please tell me more.
Yeah, Recto, I actually don't know that much about the brand, but every time I go to Korea, I go there. It's in Hannam-dong, like near Lium Museum. Beautiful store, like super minimal and just like very affordable for what it is. And there's so many of those. And people like really care about how they present themselves in the world in Korea, right? Their hair, like hygiene and like how they smell, the clothes. So they do really pay attention to fit and like tailoring. And I think that makes a huge difference.
Totally. I mean, I wrote a piece for the LA Times talking about how in Korea, stemming from after the Korean War, the society was impoverished at that point in time. And so what ended up happening is like from that point, it was just highly competitive. Yeah. Like it meant, hey, getting the opportunity or not meant food on the table or not. Yeah. And so there was this heavy emphasis that started to form in the culture of you always have to put your best foot forward. Yeah. And I feel like that has continued and permeated through especially beauty and, the clinics, which is let's talk about that for a bit, because I think what we've been talking about really ties to this, what we see happening with the trends, with people, flying to Korea for the clinics, for the products. But it stems back to this idea that in Korea, you're supposed to be a part of the collective. Yeah. So if the trend is, hey, everyone has to have poreless glass skin. If the trend is, hey, like certain features like a small face, a V-line, then, I mean, there are trends where a lot of people are doing plastic surgery to fit into this, this look.
Yeah, it's true. It's interesting. So, I mean, I think aesthetics has always been a huge part of the Korean culture. I think the extent that people are going to, and with the regularity and consistency people are going to, dermatologists and plastic surgeons, is a little bit heightened now. But it is all about presenting yourself, the best version of yourself every single day, right? Mm-hmm. And it's a whole spectrum, right? It could be really extreme at times, and it's a little bit excessive and unnecessary. And at times, and like if you hit the right frequency, then it's like you're taking care of yourself, your skin looks amazing, and you're aging gracefully, and you just look beautiful and put together and just really well presented at all times, right? So I think you just have to strike a balance, you know, like, and when it comes to cosmetic treatments, I actually don't like trends. I think you have to find something that works for you, that's appropriate for your skin type. I think it's really dangerous when you start to follow trends and you want to do the latest treatment without really having a lot of science or research or evidence behind it. Just doing something because it's new doesn't necessarily mean that it's a better treatment, you know? Like Ultherapy, Thermage, like those treatments have been around for a really long time, and there's a reason why it's been around for so long. And there's obviously new innovations coming out too, like the stem cells and ZERF and all these other treatments like Juvelook, Rejuran. There's so many of those. But I think the biggest difference between what the Koreans want and look for and versus what Americans want is Koreans are not always, when it comes to like going to a dermatologist, they're not trying to change the shape of their face necessarily. They're not trying to change how they look. They just want to improve the quality of their skin so that they have that glow, they're radiant, and they look rejuvenated. They're not necessarily trying to get a bigger lip, you know, more sharp jaw or bigger cheekbones. They just want to enhance what they have and have clear skin without, you know, any discoloration that's poreless, thick hair, thick nails, you know, thick eyebrows. But I feel like in the US, there are a lot of people who want to enhance their looks and have bigger cheekbones, bigger, like sharper jawline, bigger lips, stronger chin. And I think the approach is slightly different.
I agree the approach is different, but I disagree with the idea that Koreans don't want to change
the way they look.
I think they're just trying to change them in a different way. Where it's about symmetry and subtlety, and it's making the features look more feminine and softer and harmonized. Whereas in the US, it's, instead of thinking about how everything works together necessarily, it's, I want one specific feature changed in a fairly dramatic way. I want a rhinoplasty. I want to go in and get bigger lips, like you said. And because those with Eurocentric features tend to have like that narrower features and face. And so things as they age, like it's descending down and inward. And so they need more of that volume to lift and hold things up. Whereas us Asians, we have like the wider, you know, wider cheekbones, like a wider jaw. Typically, not always.
For sure, yeah. And I guess the looks are a little bit different. Like in Asia, a lot of people want to look cute and young and like youthful. Like youthful as in like cutesy, right? So they want to have a rounder face, whereas in the States, they want sharper features, right? Like sharper cheekbones and jawlines and want to be more chiseled. So, and not to say all Asians want that look, not to say all Americans want that look, but there is a preference, right? And you gravitate towards a certain look, depending on what you see on TV and magazines. And I think it's really interesting. And there is a way to achieve both, but the looks that they aspire to I guess, to simulate is a little bit different.
Although I wonder if that's changing now with the whole soft power in Korea, you know, almost doing like reverse, I don't want to say reverse colonialism, but they are sending back to the West their ideals of beauty. Glass skin that's poreless and like thick, shiny hair and, you know, the pale skin and doing a lot of like prejuvenation, like sunscreen. And now I'm seeing people, you know, with the umbrellas and everyone's wearing hats and that's happening here. Whereas, you know, 10 years ago, people look at me like I'm crazy doing those things.
It's true. It doesn't, I feel like it could be better still. You know, I'm usually the only one walking around the city with an umbrella in the middle of the summer here.
Good for you.
I have to, I'm so used to doing that. I also have rosacea. So like anytime I get excessive sun exposure, my rosacea will flare. I'll be really red and I'll get little acne-like bumps on my face too. So it's out of necessity too. But I think it really does make a difference. Like the more consistent you are, the better results you will get, And I always tell my patients, it doesn't matter how much money you spend on Botox and fillers and lasers. If you're not doing day-to-day skincare, it's money down the drain, right?
I want to go back, because the theme for our episode together is medical tourism. And it's really examining this huge wave that we're seeing of people traveling to Korea for medical tourism.
Yeah.
I mean, the Korean government, their Ministry of Health and Wellness reported that last year, 1.17 million people traveled to Korea for medical procedures.
Is that right?
Yeah, with 50% of them being either, dermatological or plastic surgery treatments.
Yeah.
And it totally, like when I read that, it clicked in my mind. I was like, this is why there's so many clinics. Because at first when I was walking through Gangnam, which means South River. I learned that when I was there. The Han River runs through Seoul. And Nam means south. And Gang means river, so south of the river.
Yeah.
But I was like, this is a very densely packed area full of dermatological and plastic surgery clinics. They are just stacked on top of each other in these corporate high rises. And I was like, there's no way that this is just to serve the Korean people, because in Seoul, there's 9.5 million people. For context, Ravi, because I had to look this up. I was like, what does that actually mean related to other cities? I was like, in New York, there's 8.5 million people, including the outer boroughs. So in Seoul, 9.5, and there's so many clinics.
So many, right?
But it's to serve all the people coming to Korea for treatments. So I want to talk to you about, from your opinion, I mean, your pedigree is like stacked. I won't recount it here, but it's like, there's Harvard and there's Stanford on there, you guys. Okay?
I worked hard.
Support for this show comes from Allies of Skin. Do you know what regenerative skincare is? I'm always dealing with redness and inflammation, so I've been using products that activate skin's natural repair systems, and Allies of Skin does this so well with their growth factor and copper tripeptide serums. The growth factors signal the skin to rebuild collagen and lift and firm, and copper tripeptide reduces redness and it keeps my inflammation-induced melasma at bay. Out of all the products I test year after year, I always find myself returning to Allies of Skin.
From your opinion, what medical opinion, what do you feel like is worth traveling to Korea for in terms of treatments? And then I want to get into safety and risks after that.
Of course, which is so important, right? I think it's worth traveling to Korea for treatments that you cannot get here or wherever you live. That's FDA approved in Korea, right?
So Rejuran.
Rejuran's so great, but I think a lot of Americans are still very unfamiliar with Rejuran. They see it as 7-sperm DNA and it's very sensationalized, but it's been around for 11 years in Korea. It was approved by the FDA in Korea in 2014. They have a ton of research, and it's actually by a pharmaceutical company that invests a lot in innovation and research. So I was just at their annual conference in October, and it was amazing. And the level of the level of research that they do every year, they're looking into how PDRN can boost fat cells to reproduce and give more volume to the face. Not just skin quality, but the actually regenerating fat cells and stimulating.
What's the one that we have here that's FDA approved in the US?
We don't have one.
We have,
Skin Deep?
No, it's a different one, but it stimulates the production of the fat cells. Yes.
Renuva,
I have not tried it yet.
Yeah,
what are your thoughts on that one?
It's really interesting. It's harvested from human fat cells, but it's and it has to be purified in multiple stages so that your body will not reject it.
Right.
But it's not approved in every state.
Really? Yeah. I didn't realize that. So which states is it approved for? I would assume
I know it's approved in Jersey and I think in California, but not, as far as I know, not in New York. Yeah. So that's why you don't see it as much here in New York City.
Interesting. Okay, but so tell me, so it sounds like Rejuran is coming out with their own version of this.
Yeah, and they're looking into that, and they're also looking into hair growth and not joint replacement, but joint healing. So like, could it help with post hip replacement surgeries, and it's actually really, really interesting.
I feel like I need that because once I hit 30, like every time I go to squat down, like everything cracks. No, it's like my knees, my hips. It's like
take a calcium and vitamin D.
Okay,
I think you're okay, Amy. So that Rejuran for sure, and then I guess like Juvalook is also a great injectable. It's been a little bit more controversial, but Juvalook
it's like a polylactic acid plus a hyaluronic acid filler.
Yeah, but it's so it's Sculptra is PLLA. Juvalook is PDLA. So the way
What's the difference?
So the molecule is arranged slightly differently. And when you look at the molecules under a microscope, Sculptra is more dense and Juvalook is more porous. Like there are actually more holes. And that's why you can put it under the eyes. Sculptra, you shouldn't be doing it under the eyes because you can get little nodules under the eyes or wherever there's like really thin skin. But Juvalook, because it integrates your skin better, you can do it under the eyes, nasolabial fold, where there's thin skin, you can do it without worrying about nodules. So I think that's a really good collagen stimulating injectables. Have you tried that before?
No, I haven't.
You haven't? Okay.
Yeah.
Have you tried Rejuran?
Yes, I have.
You have. What did you think?
It's really painful, but I love the immediate glow. Or I guess not immediate, but like a month later, I really started to notice it. Yeah. And then it tapers off by about month 3.
Did you get it? Did you do it once or did you do it multiple times?
I've done it twice.
You've done it twice. Okay.
Yeah,
okay.
But they were spaced out about 6 weeks apart.
Oh, okay,
I feel like I would have gotten the best benefit if I would have gone, every month,
right?
Or,
yeah, something like that. So that's
I tried Ultra Cool though, which I wonder if that's similar to what the one you were talking about.
Did you look?
Yes.
Yeah. I think it's very similar.
There's no hyaluronic acid in it.
In it? Okay. Yeah.
But the Juvalook is the one that she went blind.
Yeah.
The girl that went blind that far video. Yeah. Esther.
It was terrible. Yeah.
Terrible.
It was terrible. And so I think that's why you have to be really careful about who you go to. But complications can happen, like even if you go to the most skilled physicians, it could happen. So
it can happen here too.
Absolutely. Yeah.
And I was looking at the numbers because I wanted to have some reference in my mind for like what's actually the risk. And like, because a lot of that data is not public in Korea, they don't have exact numbers publicly available. But in the US, 1 out of every 50,000 plastic surgery treatments ends up in a fatality.
Oh, does it really?
If you're going to get liposuction or BBL, these like high risk procedures. And I was like, I've heard that before, that BBL and liposuction, there's like a very high risk of fatality with it. And I was like, why is that? But it's fat embolism, that a fat cell, and you're the doctor, Yeah.
I mean, it's pretty rare. It can be liposuction. I feel like it's been around for so long and it can be done safely in the right hands, in the OR. But yes, like you said, fat can get detached, enter a blood vessel, and then create a stroke. And that could lead to bigger complications, right? So there are things that can happen, and you just never know, right? So you have to make sure that you go to a provider who knows what to do when those complications happen. I think that's like a really important piece. It's fun to do all these treatments, and for the most part, they're really, beneficial and harmless, and you will get the results that you want. But there are, in some rare cases, where things can go really bad and then you could have those complications. And this is a very controversial topic too. Like a lot of people do nose fillers. I would never do nose fillers because it's
ocular occlusions, right?
Yeah, you can go blind from doing nose fillers. People do fillers between the eyebrows in the glabella area too sometimes, and you can do it very superficially, but there are these 2 large blood vessels that run in our forehead. So I would never do filler in that area or the forehead. But like forehead filler, for example, in Korea is very popular, right? Because they want that curvature. A lot of Asians have a very flat forehead. So they do filler to create that curvature in the forehead. And I think it's great. And if that's what you really want, you could, but you have to understand the risks. And also like the vessels that run their supratrochlear, supraorbital vessels, they run deep and then they become superficial. So it's not like they stay in the same plane throughout. And so you have to be really technical and you have to be in the right plane to make sure you don't get those complications, you know, because that's when bad things can happen.
Yeah, that's why I feel like it's so important to talk about the risks and complications. And I feel like we're just now starting to have more of these conversations in the public forum in the beauty community, especially with what happened with Esther. And like for me personally, I know I have shifted the way that I get procedures.
Is that right?
After that.
Okay.
Like, I used to have Sculptra injected on the bone in my temple, but also superficially in the dermal layer. And after that, I was like, why am I taking that risk? Like, this is a vascular region. Like, I also heard this crazy story because now that everyone's talking about these complications, I was talking with a friend who's like worked in clinics, and she was like, I saw an example of a complication where with Radiesse, it was injected here in the temples and it migrated.
Okay.
Caused an occlusion like days later after having it done. And then it ended up where it was like necrotic tissue here. And like her hair was falling out and they had to use these different like cancer drugs. And I mean, it was, after I heard that, I was like, I don't know why I'm taking risks, and I need to be like really up on the safety and understanding what could possibly happen. Whereas in my early days of going and getting treatments done, I was like, everything's going to be fine. It'll be good. Like lucky girl syndrome. It'll be all good, right?
Yeah.
And now I'm just so, I'm like really thoughtful. Like, so I went last year twice to Korea.
Yeah.
Actually, this year. We're still in 2020.
We're still in 2025.
Recording this.
Yeah.
Okay. And both times when I went to a dermatology clinic, they were like, you know, or actually the first time, because I was having a lot of treatments done at once, 7.
Yeah.
And they're like, we can put you under.
Yeah.
And I was like, no, I'm good. But like, I want to talk about the sedation.
Yeah.
Because there's a lot of risks with that.
It's so common, right?
It's so common that they offer my moderate to deep sedation. For these treatments, which is not done here.
No.
Here in the US, they only do the light sedation, which is like topical numbing, maybe some
Pronox, like nitrous,
gas,
Yeah. It's interesting. I think if you really don't think about it, it sounds more comfortable to just get sedated. By the time you wake up, all the treatments are done and you can just walk out, right? But I think that's kind of an overkill, because a lot of the treatments, I would say all the treatments that I provide, you could do wide awake, you know, like with a little bit of topical numbing for 30 minutes or so, you will feel some pain, but who cares, right? Like, is it really necessary for you to be sedated for you to get all these treatments? I don't think so. And I've seen people in Korea. So I go to Korea. When I'm there, I shadow derms because I love my derm colleagues there and I love exchanging information and tips and things like that. But there's one person that I shadowed, and he was doing thermage, all therapy, and filler on a patient. And he was doing filler with the patient sedated. And I was like, how do you do filler when someone's asleep? When I do filler, I ask patients to turn their face left and right, make expressions, because I want to see how that filler is going to
movement.
100%. And you have to see how the filler is going to settle, right? And when she smiles, is her cheekbones really large and enhanced? Because then you don't want to do too much filler in your cheekbones, right? Because then you're going to give her a golf ball on her cheeks, right? So how do you properly inject filler while someone's asleep?
What do they say?
Well, I didn't ask that question, but I found that very strange. Right?
Yeah, and there's a lot of risks with this deep sedation. Yeah. And I get the sense that not all clinics have an anesthesiologist.
No, they don't. Yeah, exactly. Yeah, but the good ones will. The good ones will have in-house anesthesiologists that's professionally trained, but not all of them.
But that's something that listeners definitely need to know when they're going to Korea. Hey, if you're offered deep sedation, the best way to stay safe is to ask, is there an anesthesiologist
100%.
who's going to be there the entire time? Because it's not just about, them putting you under. It's about monitoring you the entire time to make sure that breathing is okay. Like all the vital signs are good. There's no pulmonary There's no, like if something goes down like your throat or obstruction.
For sure. Yeah.
And I was like, gosh, that makes so much sense. Like the more I kept reading, I was like, God, I will, it's.
And also I think people should know that these treatments are not that painful. And even if it is painful, they only last for 30 minutes at most, right? 45 minutes at max. And there's nothing that you can't really not tolerate. And you should be able to kind of go through the treatments with topical numbing, really. And if you're really sensitive and you have very low pain tolerance, then just leave the numbing on for another 15 minutes and that will help. Like it may not require you to be sedated.
Or maybe like a benzodiazepine.
Yeah, you could. Yeah, you can take Valium. It will help you calm down. Nitrous oxide, the gas will help. But a lot of times you don't really need that sedation. Yeah. Yeah.
But I will say this. It was fucking painful. Oh my God. When I had the 7 treatments done.
That's a lot too.
But that's the thing with medical tourism. It's like I was there for, a week. Yeah. I'm like, okay, this is my time to really get it in. Everything that I want to try and have
done. Did you have a treatment every single day?
No, all
in one day, right?
Yeah. And this was at a private dermatology clinic and she offered me deep sedation. And I was like,
not sure. Yeah.
Yeah. I mean, I was like, I don't know about that. I want to be awake for it. Also, I wanted to be awake too, so that I could explain to my audience,
of course,
what it felt like, what was happening.
What were the 7 treatments you did?
Okay. So I did Rejuran, injected superficially face and neck. Yeah. I did ultra cool. Yeah. And that is another type of
Collagen-Stimulating.
Yes. It's similar to Sculptra, but it actually sounds like it's more similar to the Juvelo after you explain it. But there's no hyaluronic acid in it. It's just that smaller particle sizes. It doesn't last as long. The results are like after 3 months, I noticed it. But then another 3 months, like I felt like it was gone. Whereas Sculptra, the results are long lasting. But they were able to do it below my eyes, laugh lines, temples, and kind of like fanned it in here. I love that. Yeah. I thought that was
works really
great.
well. Yeah.
Another one called Rejuran.
Okay.
Rejuran. I think I'm pronouncing this right. It's like Byzn.
Okay.
But it's very similar to Skin Vive.
Okay.
So it's a hyaluronic acid booster. Okay. And then she did that in my neck. Yeah. And what else did we do? She did skin Botox. Okay. No lasers.
No lasers, really?
Did injections this time around.
No way. Okay.
Yeah, she did skin Botox. And this was what I thought was pretty cool. She had me like for 30 minutes. I just talked, maybe not 30 minutes, but like it was pretty lengthy. I was like talking and smiling and moving my face like this. And she was watching my micro expressions. Yeah. And she was like, okay, when you smile, this corner on the right side slightly turns down. Yeah. Or this eyebrow slightly raises like, 2 millimeters higher than this one, or like this eye crinkles a little more. Yeah. And so she was like, I'm going to place tiny little bits of Botox to adjust those micro movements so that when you smile, it's symmetrical and even. Yeah. When you, frown or whatnot with your brows, like it's even. Yeah. And that I loved. Yeah. But of course, it was small units.
Doesn't last very long, right?
Doesn't last. Yeah.
That's why a lot of Koreans go back to derms every month, really. Because they do a procedure. Like if you do a pico laser, you will do like once a month, like throughout the whole year, right?
I love pico.
Pico's great, right?
Yeah.
Yeah, pico's great. You just have to be really patient because you're not going to see a dramatic results every single time, right? Like it's over the course of like 6 to 8 months that you will see a change in your skin quality. It's all about consistency and maintenance, right? Because like there's an idea that you want a quick fix. You just want to do this one big procedure and be done with it.
I feel like that's the U.S. mentality here. The Western mentality is like, I don't want to do this consistently. I want to just go in, bang it out, and then have these amazing results. But in Korean culture, it's about the slow consistency of it.
Rituals, like consistency, like having like a routine. And like it's all about maintenance, right? And like doing a little bit at a time and preventing like deeper wrinkles or deeper sagging from happening in the first place so that you don't have to do like these dramatic procedures later on. And I think that really does help. It just improves your skin quality. So like a lot of times when people get a facelift too, they heal a lot better because their skin's just healthier in general. Their scars less visible because it's they've done such a good job taking care of their skin, staying out of the sun, wearing sunscreen and things like that. I think that makes a huge difference. Yeah, I like that better. And I love seeing my patients too. So I am a minimalist, and that's what patients come to me for. And I don't like doing too many. I would never do 7 treatments in one day. Like maybe I'll do 3 treatments at most, because I also want to know what's doing what. And I always explain to the patients, when you do too many things all at once, it's hard to tell. Obviously, it's different if you're flying in to do a procedure and then you have to fly out the next day, then we will try to fit in as much as possible. But if I had a choice, I would space it out so that I know that this is doing what, I think that helps.
What do you think is the appropriate amount of time to be in Korea to be doing dermatological procedures? Because I was there for a week and it felt tight.
Tight? Really?
Yeah, I had like a day and a half, 2 days on the back end before I was on the plane.
Yeah.
Again, and I kept thinking like, what if something develops?
Oh, later on.
Later on, some sort of complication. Like, what do you recommend?
Yeah.
What do you do when you go to Korea? Like, how long are you there, and where do you place your appointment in the duration of your trip?
It's so funny. So when I go to Korea, I usually go for 5 days. It's always a really quick turnaround. I went to a dermatologist for the first time because I shadow and I like see patients with them, but I don't really go there to get treatments because I can do treatments on myself. You know what I mean? And then I have, but this time I tried skin Botox, which I do here too. But one of my colleagues offered, she was like, let me do it. I can do it for you. It's like, she's not going to charge me. And so I did it and it was really fun. It's fun to have your colleagues like try different things on your face too. The ones that you trust, obviously. When my mom goes to Korea, she will get treatments. She will get treatments to get rid of pigment. She will get a lifting treatment. And obviously she can always come to me to New York, but she goes to Korea a lot more frequently. So she will, whenever she's there, when she can fit it in, she will go there too. And then it really does help. But when it comes to injectables, I think it's better to do it in the beginning of the trip so that if there is a complication, if there is an issue, that you're not on the plane back home and you don't know exactly what was done, what was used, who did it, where, because it's much easier for that provider to help resolve that issue, because you don't want to bring that to someone who has no idea what was done.
Exactly. Yeah. And I thankfully, like I have a few people in LA that I'm like, oh, if something happened, I could go to them once I'm back home in LA. So I think that is also really important. If for people listening, like if you're going to go to Korea and get treatments, make sure that you have someone that you trust back in your home state, city.
That's so smart. That's really smart. Yeah. And then like, I guess you can also like connect derms across the world that way too. And be like, this is my derm, you should stay in touch with them. And then if they have any questions, maybe like they can email or, DM each other.
Yeah, I feel like that's a good situation for you because you speak Korean. Yeah. I don't know if the others like...
I'm always like, it's so funny. I have a good network of derms in Korea, but I'm always like trying to connect with more people because I see so many more people doing like really interesting work online. And so I always want to learn.
Yeah, that's one of the things that I feel very drawn to with Korea. It's just the level of innovation. I mean, the KFDA, they're not sleeping. No. They're pushing innovation through. Yeah. And it's so efficient over there.
It is really efficient. Yeah. But also just to be clear, like just because something is new, it doesn't mean it's better, right? Sometimes it's better to just kind of wait and see how it responds and then jump on the trend. Like you don't have to be the first one to try the latest, best thing, because it may not be the latest best thing. Yeah, it may be mediocre, it may be just as good as what's on the market. And it's really hard to come out with something that's really, truly original. Like, that's why I feel like Rejuran was like a big innovation that just came out of nowhere because there's nothing like it, right? There's a new device called Zerf that's also very different from anything that's on the market. It's very similar to Thermage, but it has 2 different wavelengths. So it can go superficially and deep, and it has minimal pain, like 2 out of 10 pain level. And there's no numbing involved. So you can come in, get the treatment and walk out and go straight back to the office and no one will know that you had anything done,
I have to tell you, I'm so skeptical of the tightening treatment.
Really?
I really want to hear more about Zerf. Like, tell me more, because I've done Ulthera in the past. Yeah. I did that early on before they had the ultrasound imaging component to it. That's the Ulthera Prime that came out a few years ago. Okay. And I'm almost 100%. It definitely melted facial fat on me. Like, I have a visible temple vein now. Okay. And I just noticed that they were way too aggressive with it. And I feel like my face really kind of shrunk it. So I'm always very nervous about certain energy devices. Like even microneedling with radiofrequency. Like when I did Morpheus 8 one time, and that also, I noticed it melted facial fat. But I was one of the earlier users to try it out. And they went to depths that they now are saying, oh, we would never go to depths that deep.
Oh, really?
We're doing those depths on me for like the jawline and the lower face. And
when you were doing all therapy, was that in the States?
It was in the States. It was in Koreatown. And it was about 10 or 12 years ago.
A long time ago.
Yeah. And I did it twice. And it was incredibly painful.
Yeah.
I feel like I got a 20% lift.
Okay.
But I was like, I don't know. Sure. And since then, like I've tried threads. I'm like, I'm all on board with this.
Yeah.
I love that.
Yeah.
Actually, next time I go to Korea, I want to go to this doctor who does threads, like the smooth, not anchored, and does it in this way where like goes down into the fascia and then like back up into the hairline with a crosshatch pattern of like 40 of them. And so then you're getting like a really nice lift, because I'm not ready for a facelift, but I notice a little,
skin laxity.
Yes.
Yeah. No, you look amazing. You look amazing.
The lighting and
oh my gosh, no,
very sweet.
But threads work really, really well. Some people just find that really scary. Just the idea of having threads in your face for several months.
But they dissolve.
They do dissolve. Yeah. And then going back to the lifting, like ZERF is radiofrequency based. It's so interesting because I've been doing all therapy for so long now, and I've never seen fat loss. I sometimes in Asia, Korea and other places, they recommend doing it twice a year, which I think is an overkill. I would not recommend doing it more than once a year at most. I think when you start doing it twice a year, that's when you experience fat loss. And also
I did it twice in 1 year.
Oh, in 1 year?
Yeah.
Okay, maybe that's why.
And they recommended 3.
Yeah, no.
And I was like, this is way too painful. By the time I got to the second one, I was like, I can't do this.
Okay.
Yeah.
Maybe that could be why. And also I've seen in Korea, they sedate so that they can do a higher setting. But higher setting isn't better, right? Like there's only so much your skin cells can work to produce collagen. Just because you're creating more damage or creating more stimulation, it doesn't mean that they can like produce more. There's a plateau, right? There's a physiologic plateau. So that's why higher setting more frequently isn't better. And there are patients who will say, can I do all therapy twice a year? Can I do this at a higher setting? And my answer is like, no, like let me save you money. There's a limit to how much this device can do for you. Do it only just once a year and you will get the most benefit, and that's it.
I love that conservative approach.
You have to, right? And then we're trying to, the goal is not to do as much as possible. Actually, the goal is to do as little as possible so that you get the results that you want and look natural. And that's how you achieve that undetectable look that not just me, but a lot of my colleagues have been doing for like 10 plus years. Like this undetectable thing is not new, right? Like you stimulate your skin cells to produce collagen with radiofrequency based or ultrasound based treatments. And then you wait for 3 months. And then you have the patients come back and then you do a little bit of filler to tweak it. Because in that way, you are requiring less filler to get the look that you want. And you can really tweak it and put little drops all over the face so that you get a sharper jawline, a more defined cheekbones, a more beautiful plump lips without making you look like a Barbie doll, right? And just like gradual approach, I think works better. And patients can really see the transformation in their skin. And it's really subtle that it's almost undetectable even from their husbands. Because a lot of women, I notice, don't like to tell their husbands exactly what they do at their dermatologist. And
no, I'd be like squirreling away cash and like paying cash when I would go to my treatments in the beginning.
Yeah.
And I remember for a while when I discovered I could use my HSF card, HSA card for Botox. I was like, this is amazing. I'd come home and be like, something happened to your face. I was like, I got stung by a bee. Don't worry about it.
That's so funny. And so it's interesting because I do hear that question a lot. Like, is Ulthera going to melt my fat? Like, is that going to really change the way I look? And I'm already they're always like a lot of women are worried about losing fat, right? So they don't want to do anything that will
because
accelerate
we lose
that
fat as we age.
Yeah, exactly. And as we age, it's not just the skin and the fat. Our muscles get thinner, our bones get less dense. That's why everything starts to just migrate down and forward, right? You need that support. But based on my experience and most of my colleagues, if not all, fat loss with Ulthera is really not that common.
So it sounds like with your approach, going being very conservative, there's less likelihood of that happening, the fat loss.
Yeah.
But like I've talked to other women in LA, and there are some practitioners who over the last 10 years were doing Althera. And like I went to dinner a couple of years ago with this woman, and we were like at a dinner party and we were talking about it. And she was like, this prestigious Beverly Hills dermatologist she went to, she was like, he had me doing Althera 6 times in a year.
Why would someone do that?
Because they were like, you need to keep coming in and like stimulate
for the same.
And she was like, I want more. Like these, you know, some of these women have like, you know, money is no indisposable income. They have a lot of it. And so they're just like, oh, okay. Like if it's going to stimulate collagen, like I'm down to do more treatments. And some places will just take that. And be like, okay, sure, we'll do another.
Are you sure it wasn't like one time on the face, one time on the neck, one time on the arm? Like no, it was the same face. Okay.
And her face was extremely hollow. And she was like, I don't know what to do about it. Like so upset. So like there are cases like this that exist out there. And I think that that is what worries people. But, you know, having this conversation, like other conversations out there, it's so practitioner dependent on the outcome. It's not about, oh, was it this product or was it this laser that did it? And they're now deemed as bad, right? It's just, it can be wielded in a right way to get a great outcome in some hands. And then it can be wielded in a not so great way.
And also you need to find a provider who will say no.
That's like, so important.
Like you don't need that treatment, or that's not the right treatment for you, or you're at your max. Don't like, you're at a very slippery slope and you're not going to recognize yourself if you do this treatment, you know? Or for someone to say this treatment is not going to give you the results you want. If someone has really strong skin laxity and they need surgical procedures, then the provider should say, what you need is a facelift. You know, there's only so much a filler, Ultherapy, and Zerf and Thermage can do for you. And you need that someone like that you can trust, and then to have colleagues that they can refer you to so that you can have a trusted plastic surgeon or oculoplastic surgeon for a BLAF, you know, whatever it is, so that you can get actual professional opinion on what's best for you.
Yeah, I feel like, you know, speaking from my own experience and my friends, like other women I chat with, it's like we stand in the mirror and we're kind of like pull it back. And we're like, how do we get this result? And then, but really, truly at the end of the day, to like get that kind of result, you need to have a surgical intervention.
No, it's true. Like sometimes when you're in your 50s and 60s, you know, and if you're ready, it's time for a facelift. But I will say, people have been asking me, so all my patients have been asking me about when should I get a facelift? Like it's a big topic now, right? Like even people in their 30s, they're getting ready to get a facelift. And it's really disturbing in some ways. And I had a 65-year-old female who's a breast cancer survivor who told me that every time she goes on social media, she sees something about plastic surgery and now she feels pressure to get a facelift. And I thought that was so sad. I was like, you're beautiful. Like, what do you mean? Like, if you want a facelift, yes, we can do that. I can refer you to someone that I trust who's excellent, but you should never feel pressure to do that. But she was like, but every time I go on social media, everyone's talking about facelifts and I can't, like, it's impossible to not look at it. And I think we're at a place where it's a little excessive. It's a little bit too much. And I think we may need to dial down a little bit because now there's too much information and everyone's getting flooded with having to look a certain way. And I think it's not healthy. Like it should be fun and you should just do procedures to feel good about yourself, not because you feel pressured by society to look a certain way. And I found that very shocking. Coming from a breast cancer survivor who was like in her 60s and is beautiful. And it really like stuck with me for like days.
I feel like part of that, and what this is where social media is good and bad, is that for the longest time, this idea of like aging gracefully, at least in my mind, it is the metaphor of the beautiful swan on the lake, where it just looks so graceful and beautiful. But what you don't see is like the feet going like this, like crazy under the water, underneath, like all the work that beauty is, that invisible labor, right? And so what social media has been really great about is to reveal that, hey, underneath the surface, all this crazy work is being done. And here's what it is. So it's kind of democratizing it. It's giving more access and information to people. But it sounds like in some situations, it's creating, and this is where the negative side of social media comes in, where it's too much information and it's, you know,
And the algorithms, and when you search it targets you. So you see more of that information too, right?
Right.
And then now you're being flooded with that info, and you start thinking like, do I need this? Do I need to get this? When do I do it now? Like, is it now or next year or 5 years later? It's interesting.
When we first started chatting, we were talking about like how old we are.
Yeah.
Like how old do we feel? And I would say, kind of going back to that, one of the best things about getting older, at least for myself, is that I feel like I have a very strong sense of who I am. Yeah. And so when I see external messages on social media or billboards, like it doesn't affect me in the way that it did when I was younger. And I really struggled with my identity and self-esteem at that point of time. I was in a fragile state. Yeah. Whereas now I feel like have these things in my life that have allowed me to develop more confidence. So there's like this, and I almost think of it like there's this internal, like these walls here where I'm like, I decide which messages come in. Yeah. And then I turn inward and listen what's in. So
on that, right? You had to work a lot to get to that place.
And I feel like a big piece of it was becoming a mom and giving myself more grace through that experience. Yeah. 2, developing a career and finding success in it. I have drawn so much confidence from being a content creator and essentially running my own business. We're like little entrepreneurs.
Of course. Yeah.
But prior to that, was really struggling in what's my purpose and my career and all, and figuring out what I want to do in life. Yeah. And once I figured out what I wanted to do, started doing it, felt like I was good at it, felt like I was, learning, growing, building success. It's like that confidence kind of compounded and then it became stronger.
Yeah. 100%. I mean, you're like a very wholesome person, right? Like you have a thriving career, you're an amazing mom, loving wife. Like it's like, it's not just because I have patients who will come and they think that fixing one thing will fix their life. And that's when I have to sit down with them and say, how's everything going? How's your career? How's your lifestyle? How's your relationships with your family and your loved ones? Because fixing that jiao is not going to change your life. But having a proper mindset and having like that commitment that you're going to make the adjustments that you need, whether it's relationships or exercise, whatever it is, and like having a more positive outlook in life and being ready for that journey is so much more important. And so that's why, like, when you find purpose in life and when you feel supported by your community and the people that you love and you feel protected and safe, that's when you can really thrive, right?
How frequently does that happen where you have a patient come in and you have to do this kind of mental health intervention?
Not that often, but you can kind of tell right away. Like you can tell right away. And also like, most of my patients are self-made, very successful, career-driven women and men. And then they know themselves really well and they have a very clear vision of what they want in their lives. But there are some people who struggle and need someone to really actually, more than anything, listen to them, right?
Give me an example of a patient that came in and you're like, hey, I have to sit down and say, hey, maybe this treatment's not right for you, and do like a mental health check-in.
It's usually a younger person who's trying to achieve a certain look. So they feel like they need to look like a certain influencer or celebrity. And that's never a good sign, right? Like you wanting to look like someone. I mean, I always tell my patients, and I make videos about this too. You're 1 in 8 billion in the world, right? So you are actually by definition one of a kind, and you shouldn't really try to look like someone else. You should try to look like the best version of yourself. We can clear your acne and clear your discoloration and make your skin more radiant and clear and more lifted. But like you wanting to look like an XYZ person will never work. And they will really they will dress like them. They will do their makeup like them. They'll do their hairstyle like them. And they will say like, but this person has this look and that's what I want. And they will get really fixated, like in a very extreme, to a very extreme degree. And that's when you know, like, okay, like this person is not interested in figuring out what works for them. This person is more focused on wanting to look like someone else because they want that person's life. And they think if they look like that person, all the doors will open, the heaven will open the gates, and all these opportunities will come and their life will be perfect. And it doesn't work like that. It really doesn't work like that.
I feel like you're talking about my younger self. Like that. You like described like me in my early 20s going and getting lip filler and getting filler blindness. Like,
oh my God.
The younger photos, like I had huge, like overfilled lips.
Really? I can't imagine.
Yeah. I mean, I
want to see photos.
Okay. I had overfilled lips. I was like, oh, I'm going to do, Botox masseter injections here. And like, I wanted to look like a certain celebrity, socialite, and had these ideas in my mind, like, oh, if I like fix these little things, like, I don't think it was as conscious as that, but like looking back now and having, some hindsight on it, 2020, all that, I definitely was going through something similar in my early 20s, but then it was through like building up the other parts of my life that allowed distance from that and to see that, hey, I have so much agency to create the happiness, security, and confidence that I want. And then that just compounds. Like once you see it happen once or twice, you're like, oh, wait, this is how I get the life I want. This is how I feel better about myself.
Yeah, exactly. Yeah. And it's so interesting because it's really hard to do that on your own. Sometimes you need like external support, but also we were talking about this briefly yesterday on Breaking Beauty podcast too, like trends in Korea. Like, and we were talking about how having double eyelid used to be a huge trend, and it's not anymore. It's like now people are against having double eyelids and they want to maintain and keep their single eyelid look. And that's like the perfect example of how trends change. And how you should not follow trends, because what are you going to do with a double eyelid and then now it's not the thing anymore and you're just so focused on and obsessed with following trends because you want to be current and relevant, and that never works out, right? Like you have to figure out what works for you, what makes you, like what will highlight your features, and just like learn to love yourself and be kind and gracious, and obviously like be objective, and like there are things you can do to improve, but there's a difference between wanting to improve things and wanting to fix things. I think it's like a very fine line, and you have to draw a line at some point. And like getting rid of that wrinkle and getting rid of that jowl, not going to change your life.
Definitely. I mean, I've spoken about this on the podcast before in other episodes, but after I had my daughter, I have two girls.
Okay.
When I had my first, who's 7, I remember so distinctly when she was born, I looked down into her small face and I instantly had this overwhelming feeling of we are all born beautiful, just the way we are. And I feel like in that moment, I was able to truly see myself in a way I had never seen it, because my daughters have so many of my features. And in that moment, because I've had upper blepharoplasty for a double eyelid. And in that moment, I was like, oh my God, I'm never going to do plastic surgery to ever change a feature, because I can see it now that like that individualistic component of it is so beautiful to preserve it. So now I'm all about just preserving.
And if you want to get plastic surgery, that's okay too. I'm just saying, like, don't get so easily influenced, right?
Yes.
But I think we don't spend enough time just being like, okay, I have a big nose, who cares? I have like crooked teeth, who cares? I have crooked teeth, like, I don't care. Like, I like them. My dad has crooked teeth and I think it's kind of charming. And I mean,
it's like those little things that no one else sees, but like we see.
That we see. Yeah, exactly. So I think like beauty is here to make you feel great about yourself, and you can always do things that will make you feel more confident and present yourself in that way in this world that's so chaotic all the time. But I wouldn't get so obsessed with it.
Yeah. And it's definitely easy to with the algorithm structured the way it is.
Exactly. Yeah.
And I also want to talk about the Uni app. Uni app.
Oh, Gangnam 언니?
Is that what it's called? It's
an app where you find clinics and discounts and stuff, no?
Yes. Yes, it's called Gangnam 언니.
I think it's Gangnam 언니,
Okay. I've always heard it referred to as 언니.
언니? Yeah. Maybe that's what they... I've actually never used it. I've never seen it, but I've heard of it.
Okay. I went on the app because I wanted to just get a sense of it. And I'll say this. I'm a little skeptical because I was scrolling through and I was like, how does every doctor and every clinic have a 9.3, a 9.5, 9.6 out of 10 stars. And I was like, are they all like really amazing? I mean, it made me a little skeptical also because I had heard that some of these clinics will like infiltrate like Reddit threads. And
oh, is it really?
Yes.
Oh, I didn't know
And
that.
they'll put little placements here or there that look organic as though it's a customer reviewing it, but that it's paid for.
Interesting.
And so I think I'm just on I'm on alert because of that and skeptical. Yeah. So, but let's talk through like what's a major red flag when someone's going and they're doing their due diligence and research about a clinic. What are the things that they should look out for and say like, okay, this is probably a place I don't want to go to. Yeah.
I would always try to look for a place with a board certified dermatologist. Because if you actually look, there are a lot of clinics in Korea that's not run by a derm. It's actually a lot of times a family medicine physician or OBGYN. It's actually not a derm. A lot of times, I would say majority of the times it's not.
Which is crazy.
Yeah.
I read that there, like in, here, I have it here. It was in 2020 that Hong Kong billionaire heiress went to Korea to have liposuction and breast implants done. And during the liposuction procedure, she passed away.
Oh my gosh.
There wasn't an anesthesiologist there. And the procedure being done was by an orthopedic specialist and not a plastic surgeon.
Oh, wow. Okay.
And this is a billionaire heiress.
Yeah. That's funny. That's kind of wild, right?
So wild.
That's pretty wild. Yeah.
So it just goes to show like it's on, the onus is on us traveling there to really vet. So you're saying like credentials.
Also like, just like you were saying, and we were talking about earlier, having an anesthesiologist, if they do recommend sedation, just to make sure that it's being monitored and administered properly. I would also go to a clinic that has a very clear plan, right? Like they are not recommending the same products or treatments to the same person. They're customizing it to your specific needs and have an actual plan about what you can do. But people also have to be aware that one trip to Korea is not going to change your skin forever, right? Yeah. And I think that's what people hope for. They're like, I'm going to go to Korea. I'm going to get all these treatments. And they're super fun. It's actually really fun to go to these clinics and learn about these treatments and get them done. And you will get benefits of it, but it's not going to last, more than like 3 to 4 months. And so consistency is key, which we talked about before. I would also it's really hard, but I would go where there are not that many foreigners. Like if you walk into the clinic and it's packed with foreigners, it's probably not where the locals go. And that I feel like largely happens because they're targeting a specific demographic or their marketing strategy is to get more foreigners into their clinic. Nothing wrong with that, but I think if you want that true Korean derm experience, then I would go to a place where they should have a translator so that there's no, nothing's lost in translation, but there is a good mix of the locals and foreigners.
Totally. Yeah. I mean, I went to a private dermatology clinic that was referred to me by a contact.
I saw your video. Yeah. You needed a referral, right?
Need a referral.
Yeah.
And so the friend owns an entertainment company and owns a beauty brand, and he goes there to get treatment. So I was like, okay, I know this place is great. And it was wonderful. Yeah. Like they see one patient at a time. Yeah. You go in. I was there for 5 hours.
You were there for 5 hours?
Yeah.
Wow. Oh my gosh. Okay.
I mean, they just really took the time to do like pre-skin treatments and post. They went to the pharmacy and got my supplements for me for aftercare. It was like very concierge touch to it. Yeah. But they don't have a website on Google. They don't have an Instagram page.
Wow, okay.
Like the only way to find them is they have a website on Naver.
Okay.
But even that's down now. And I wonder if that's down because after I went there, I posted about them and like my audience was like going there. And now I'm wondering, like they trying to go underground again or what?
They're at max.
Too many foreigners.
They're at capacity.
Yeah. So then how do people wanting to go to a place that the locals go to, how do they find those places? Because a lot of them don't market to foreigners, so they're not on Instagram.
Yeah. That's the hard piece. I mean, like how do you get that information? How do you know it's a reliable provider? I actually don't know the answer to that. Like, I think you just have to follow Amy and then she will give you, all the details on where to go. Exactly.
I won't say no to that. Just, do it.
But that's a hard piece. Like, that's the hard part. And also, like, Gangnam just means like south of river, right? But there's Gangnam neighborhood too. Like, within Gangnam, there's Gangnam. And there are so many derm clinics there, but a lot of the really good ones. Do you remember where it was? Which neighborhood?
Cheongdam.
Exactly. So all the best ones are in Apgu and Cheongdam.
Yeah.
So they're in Gangnam, which basically means, like you said, south of river, but the neighborhoods are Apgu and Cheongdam, not Gangnam itself. So Gangnam is where you see these skyscrapers with 20 clinics on top of each other. Nothing wrong with that if that's what you like and it's convenient. But if you want that concierge, one-on-one, hands-on experience, you go to Cheongdam, right?
But the thing is, they don't always have a translator there.
Is that right?
There was no translator there. Doctor did not speak English.
No way. Okay.
There's 2 other staff there who did not speak English. And my friend who got me the appointment, they had someone who worked for them who came with me to be my translator and stayed there with me the entire time.
Okay.
So that's also what makes it challenging, I think, for people. But so I do agree that if one can go that route, but there are a lot of barriers to entry to go that route. But there are also some great clinics that are targeted towards foreigners. I think you just have to
find them
and vet them thoroughly and really do the due diligence to ask a lot of questions, like who's going to do this procedure? If I'm going to be put under the anesthesiologist one.
The good thing about Korea is that there are no mid-levels like nurses and I don't think PAs exist in Korea. It's like nurses or NPs and they're not allowed to do procedures. So usually it's always the doctors who do the procedures themselves. But I would make sure that the devices are up to date. So like, if there's a specific device that you want, then I would make sure they have it there, that it's up to date. And then I would just make sure that you don't do too many procedures all at once in one day, if that's possible. Yeah, I think that's important. Yeah, so that your skin doesn't get overwhelmed,
Oh, yeah. Yeah, my skin was on fire. Fire.
But you didn't have time. You're a busy woman.
Oh my God. I know. By the 3rd treatment, she was like, I'm, fast. Or she said like Bali. And I knew I know that word in Korean. So I was like, oh, and I could feel she was like going very fast.
Yeah.
Right. I think she was concerned I was in pain.
Yeah. Oh, wow. Beauty is pain.
Yeah.
It pays off.
Yeah, it does.
It's worth it. Yeah.
I'm down for it. I personally only feel comfortable going to places based on referrals.
Yeah.
And even it's the same for me here in the States. Like I want to see a walking, breathing example of that person's work.
Yeah.
Because then I'm like, okay, now I feel comfortable. It feels legit. That's not to say that things can't go wrong.
Of course,
but it just gives me the reassurance
like
I need.
I mean, word of mouth is still the best referral, right? Like it's coming from a trusted friend or a colleague and you have a peace of mind that, that the work was done beautifully and safely. And I think social media does play a big role, but the patients who come to me and stay with me for a very long time, it's usually through word of mouth. It's like a friend, a sister, a cousin, and they come with the confidence that they'll be taken care of. And I think that eliminates a lot of anxiety and uncertainties and that I will only recommend things that will be beneficial for them, right? And I think that's just like how life is, right? Like when you're trying to buy the best, what's like the most esoteric example? Like if you're trying to buy like a best butter, like who do you go to?
That one foodie friend.
Yeah, exactly. Yeah. Right? Like that's how it starts. And then you will obviously do your own research too on Google, but like it gives you a good point of reference, right? Like same thing, like if you want the best jar of kimchi, like you go to like, I don't know, like your next door neighbor or your mother, like, like your family members and then see what they have, what they recommend. So I think word of mouth is still very powerful. Yeah.
Another thing that I tell my audience is that look at the face of the injector or the practitioner.
And the staff.
Because that is an indicator on what their general aesthetic is like, what their eye deems is beautiful or balanced.
Yeah.
I used to go years and years ago to an injector and she did Botox in a manner that gave a bit of a Spock eyebrow, like a high arch.
Yeah.
Because that was her aesthetic. And then lo and behold, what happened? I had a high arch to my eyebrows. At the time, I was like, oh, I think that this is just how, Botox it's supposed to look. It's supposed to be done. But then when I tried other practitioners and I explained, actually, I always get this like very arched look to my brows and I don't love that. And they're like, oh, well, here's a different way we can do it where that doesn't happen because my brows are generally straight across. So I just want to lift where they both lift evenly. Right. And so after that experience, I'm like, oh, it makes sense why because she's administering it to herself in that same way. So that's how she's doing it on patients. So now I always look at the practitioner too, like, do they have the type of aesthetic I'm looking for?
Yeah. It's so important. It's like the quickest, easiest indicator, right? Of whether you guys have a same idea of beauty and same eye for aesthetics.
You look really great. You're like very natural. You do.
Oh my God. I feel my age right now.
No, you have like glowing skin. You look very natural. Like you were telling me earlier that you do you administer it yourself. And I'm like, I don't know what you've had done. Like that's always the mark of beautifully done work is when you look at the person, you're like, you look really great, but I don't know why.
Yeah. I don't do very much actually. I do a little bit of Botox. I do Botox regularly. But I do the skin Botox. So like I do skin Botox all over my face. I do Zerf. I actually, when I was in Korea, I asked them to do just the right side of my face because I wanted to see, is it working? Does it work? Is this real? And it does. So I came home and I did the other side myself to match it, like 8 weeks later. And then Clear and Brilliant. I love that laser. Works really great. I did a little bit of Pico previously. It's been a while now, and that's really it. I'm thinking about doing Sculptra, trying to figure out how I'm going to do Sculptra on my face on my own. I think I can do
the help of a friend for that one.
Yeah, exactly. And I also use Cannula most of the time. So that's like if you use a needle, then you can just do it right away. But with a Cannula, which I think is a lot safer, sometimes it requires a little more finesse.
And it's safer because it has that soft tip, so it's not going to puncture blood vessels.
Exactly. The tip is blunt, so it's going to push the blood vessels away instead of piercing through them. And you can do it. Like I should post a video. I took a glove, filled it with water, and I tried to puncture it with the cannula. You can't unless you really force it. But with a needle, even with a gentle pressure, you poke right through it and you see the water coming out. Yeah.
What I found fascinating was when I went there the first time for those 7 treatments, she used a needle.
Did she really?
Yes.
For everything?
Everything.
Oh, wow. Okay. Interesting. Okay.
And that was part of why she was able to work so quickly too. But I was shocked by that.
Yeah.
Because here in the US, cannula is really what most practitioners do. Safety reasons. And to go slower. And inject slower, like things like Sculptra, you want to inject that slow.
Yeah, exactly. Yeah. That's interesting. I haven't seen any provider in Korea that uses a needle. I've only seen them use all of them, cannula. Yeah, that's really, I know more providers in the US that use needles than cannula. Yeah. So, and then microneedling. I do microneedling with RF, with salmon sperm.
Silfirm?
No, I do Potenza.
Okay.
Yeah, Potenza, because they have a fusion tip, which is, have you heard of the fusion tip?
It doesn't go as deep.
It doesn't go as deep, but it's designed to deliver skincare into your skin. And it enhances absorption by 67%.
Is the radiofrequency energy delivered at a consistent?
Yeah.
Consistent,
yeah. And it's pretty superficial. Yeah. And you don't go that deep.
Okay.
Yeah.
I haven't tried it. After my Morpheus experience, I was a little
nervous about it. Yeah. Don't do it.
Yeah.
Don't do anything that makes you nervous, PRP, I feel like is a great treatment in combination with microneedling. Yeah. That's a good one. That's an easy good one. Yeah, like for a glow. I guess I do more than I thought I did. But I'm always, even this morning when I was getting ready, I was like, when am I going to do when am I going to do Potenza with Rejuran? I'm trying to find the time to do it because I want to do it before the holidays, but then I have patients and I don't want to look crazy.
Oh yeah.
And then I have to record, so then I can't be red. Because when you do microneedling, you can't do any skincare for 48 hours, right? And so I was trying to figure out my schedule. When can I do it? I'm going to find the time.
I know. It's having to budget in that recovery and that downtime.
Yeah,
but thankfully it's becoming more acceptable to go out and have a swollen red face with not nodules, but and all
bumps,
that.
Yeah. No one cares.
Swelling.
Everyone, you move on. You go on with your day. Yeah. Put on a mask. Yeah. So you're going to Korea?
Yes.
Next year?
Yes. I don't have. It's not
a firm date.
Yeah, firm date, but I am going and I'm going to do the threads.
You're going to do threads, okay?
Yeah, I'm going to do that, and
I can't wait to hear all about it. You're going back to the same provider?
I'm going to go to someone else.
Also, okay, gotcha.
Every time I go, I like to try a different provider.
Okay.
Yeah, although I would 100% go back to that private dermatology clinic again.
Yeah.
But I want to try different treatments.
Yeah.
Yeah.
So threads, is there anything else that you're super excited to try?
I feel like threads is the one that I'm excited about because the technique is different than what I've seen in LA. But other than that, I don't know if there's anything else that's really piqued my interest. Maybe I would do Ultra Cool again.
Yeah.
If they do it. I mean, I have a great Pico girl, that place that I go in LA for that.
Okay.
I have melasma.
Yeah. Okay.
And so I'm constantly battling it. And I'm on hormone replacement therapy right now because I'm in perimenopause.
Okay.
Yeah. And so the medication stimulates my melasma. And so I've had to do Pico pretty regularly this year.
Do you use hydroquinone?
It irritates my skin.
Does it really?
Yeah.
It does that to some people. Yeah. What about tranexamic acid? Have you tried that?
That's great, but it's just slow going and it's not strong enough to battle the melasma, especially with the HRT triggering it.
Yeah.
For a while, I was doing oral tranexamic acid, but it just became a lot because I take spironolactone, like thyroid medication, and I just felt like, it
was a bit much.
Because it is a slight diuretic too.
Tranexamic acid?
Yeah.
It shouldn't be, but it can increase your risk for clots, blood clots. So you should do like a screening test to make sure you don't have any risk factors. But it works really well for melasma. But with HRT, it may not be the right treatment.
And at what dose?
It's usually 650, split in half, morning and night. But you're not supposed to take it, every day. You're supposed to take it. Well, the way I do it, I usually prescribe it for the peak summer months. So June, July, August, September, and then you come off of it because that's when you need it the most, and you don't want to be on it like all the time. You just want to be on it when you need it the most. And then you can usually maintain it topically once you come off, like in the fall, spring, winter. I feel like you need it less.
What do you think about if I were to just take it 2 weeks out of the month? Because it's during when I enter my luteal phase.
Yeah.
The luteal phase and then the menstrual phase.
Yeah.
Like those last 2 weeks.
Yeah.
Because then my hormones have skyrocketed. And I notice that it really starts to darken during that time period. But would that be too disruptive for my system? To only take it for those 2 weeks during my cycle?
Yeah. I don't know. I don't know if you will get the benefit that you would want by taking it just half of the time. I also don't think it is worth being on all year round. You should really just do it in the summer months, Yeah. Do you think you will be on HRT for a while?
I mean, maybe
possibly
for a while.
Yeah. Okay.
I mean, it's really helped. I had just horrible brain fog.
Oh, wow.
I was waking up in the middle of the night at 3 a.m. And they say that those are 2 early signs of perimenopause because that drop in progesterone affects the hormones. And then you get that cortisol spike in the middle of the night, which wakes you up. And so then my sleep was disrupted. So then during the day, the brain fog would be even worse because I wasn't getting good sleep. And then it was just kind of a domino effect. So my doctor was like, let's try this, see how you feel.
Yeah.
It's improved the quality of my life so much. Okay. I feel 20 years old.
Oh my gosh.
Like
no
in
way.
terms of like brain capacity and like alertness, my memory.
Okay.
Yeah. And I didn't
Was
realize.
it instant?
I mean, no, it was gradual because we had to adjust the dosage.
Yeah.
And it took about 3 months until we got the dose right and I was in a rhythm.
Okay.
But I mean, I didn't realize for how long I was struggling with that brain fog.
Oh, interesting.
I just thought, I'm tired. I'm getting older. I'm kind of run down. Yeah. But then I didn't realize like I don't have to live like that. And there are options and this is a safe option.
Yeah, of course. Yeah. It's good. It's always nice when like things actually work, right? You feel like yourself again.
Yes.
Yeah.
Oh, that was how I felt with spironolactone. Is this something you prescribe in your practice?
Yeah. Did you feel, you mean like you felt more foggy?
So this, sorry, I'm like totally going off on another tangent here, but you were saying like, oh, it's really great when something works. For me, spironolactone worked so well for my hormonal acne.
Yeah. It's amazing, right?
Yeah, I was getting breakouts every month around my period, around my mouth.
Yeah.
And then the problem is like you're constantly playing catch up because you're like, I got to put this out. And then by the time I put that pimple out, then my period would pop up again and I would have another one.
Exactly. Yeah. What dose are you on?
100 milligrams.
That's a good dose. That's a solid dose.
I started on 50.
50? Yeah.
Hoping that would work, but it wasn't enough.
Yeah, 50 is really low. You can safely go up to like 300 milligrams once a day. So you can so you can go, you have room.
Okay, good.
You have room.
Okay, because I was worried that mine was high. I was like, ooh.
No, 100 milligrams is not high. Yeah. Wow. That's like a very average dose. Yeah.
Okay, so I feel really good about it. The only thing is that I have to be very diligent about drinking water, getting salt, electrolytes, all of that.
Have you noticed any change in your hair?
Yes. Okay. My hair got really thick when I started spironolactone.
It's amazing, right?
Yeah. And it's great. I mean, I went to IMCAS.
In Paris?
In Paris, that dermatological and plastic surgery, like anti-aging conference, not last January, but the January before. So 2 years ago.
Okay.
And I sat in on a panel on hair loss and hair restoration.
Okay.
And one of the things I heard there was that spironolactone is like one of the first things that they'll prescribe for hair thinning and hair loss. Is this something that, because I know a lot of dermatologists, work with patients to help them with hair thinning and hair loss. Yeah. Like, what do you do in clinic?
Yeah, for sure. Like especially if you have hormonal acne and hair thinning, which are sometimes also signs of, PCOS, then spironolactone works really, really well because it will take care of both, really. But hair's tricky, like Minoxidil works really, really well. A lot of times people will take it as a pill because doing it every night topically can be really messy sometimes.
But I've read it only works for like 60% of
the people.
Yeah.
It doesn't work it's not a home run for everyone, but it does help. Then even like stopping the progression of hair loss and actually keeping the hair that you have, I think it makes a difference. And then PRP helps a lot. But now people are looking into topical minoxidil to dutasteride and as a medication, and then like actually delivering it directly into the scalp to stimulate your skin hair follicles to grow more hair. And a lot of times you do it in combination with microneedling or with a tattoo device. Like, because you have to be at a specific depth, because you can be too superficial, you can be too deep. You have to go where the hair follicles are to wake up the stem cells. And it's usually between like 1.5 to 2 millimeters. And like the tattoo machine like delivers that and like keeps the medication there. So that's interesting. I may start doing that. And then there's a new medication, it's the UCLA PP405. It's a new medication that studying, and it's in phase 2A clinical trials. I think they're going to enter phase 3 clinical trials early 2026, but it actually wakes up the hair follicles stem cells directly. It's not like spironolactone or minoxidil or finasteride, where it's increasing blood flow to the hair follicles or causing anti-inflammatory effects to stimulate hair. It's actually waking up the stem cells at the hair follicles to stimulate hair. And I was looking at the data, and I made a video about this recently. I forget what, it was like a significant number of patients who had really advanced baldness had 20 to 30% increase in hair thickness in 8 weeks. It was pretty quick.
Topically applied?
Yeah, topically applied. I think it was like 0.5% gel, and they compared it to a vehicle. So like it was a controlled study, and it was really, really promising because there's nothing like it right now. So if it goes well, it probably will get FDA approved maybe 2028. So it like takes time, Yeah. But it's a completely new medication, and like there's so much buzz around it. Yeah.
So many women and men too are facing hair thinning, hair loss issues. Because when I was looking at the top procedures that people go to Korea for, number 5 is hair transplant.
Oh, hair transplant? Really?
Yeah. I was surprised by that.
I'm shocked.
But then I talked to an influencer friend of mine in the beauty space, and her husband has gone to Korea now twice for
to get a hair
transplant. Oh, wow. She said it's $4,000.
Oh, wow.
Here in the US, it's like 20,
it's a lot more
25.
Yeah. Well, that's interesting. See, I'm learning something new too. I didn't know hair transplant was like a thing in Korea, but it makes sense. Yeah.
I feel like it's one of those procedures that people don't yet feel comfortable talking about when they have it done, because there's a lot of, culturally, like, I don't know how to say this without, because I don't want to offend anybody. Yeah. I feel like there's a lot of shame around it, or
hair loss,
or like, still. And, hopefully that changes over time, because I don't think anyone should feel ashamed of wanting to like do something for themselves as it relates to procedures. Yeah. But I do feel like that is one where, especially women, don't feel necessarily comfortable being as public talking about it online.
Do you think men are more comfortable talking about it?
Yes.
Gotcha. Okay.
Yeah. Well, when I see the examples of content online, people talking about it, it's typically men.
Men, right? Yeah. I mean, there's so many celebrities getting hair transplant, like male celebrities, right? Because it makes a huge difference. Yeah.
Yeah. Yeah. Well, even in just the balance of the face.
Yeah, 100%.
Yeah.
Yeah, it's true.
Well, this was so lovely.
This was so fun.
I had the best time chatting with you. I want to go to Korea together.
Oh my God, it will be really fun. Yeah. I'm sure it will happen.
Yes.
Yeah, that will be wild. And you will take me to this private clinic.
Yeah, I
will. And I will watch her do everything she does on your face so that I can learn and talk to you and hang out all at once.
I would love that. And then we can go shopping together. Oh my gosh, we can go to that Korean fashion. Yes.
There's so much to do.
Dr. Kim, thank you so much for being here.
Thank you so much.
Will you please tell the audience where they can find you, your clinic?
Oh my gosh. On Instagram, you can find me anywhere. Instagram, Dr. David Kim. Same thing with TikTok. And my clinic should be up and running. I'm opening a new clinic in Soho early 2026. So hopefully construction will be done. And
it's exciting.
Yeah, I can't wait. It'll be really, really fun. Yeah, I just want a happy place where patients can come and hang out. Yeah.
It's going to be wonderful. I can't wait to come visit.
Oh my gosh, you'll have to come visit.
Yes, I will.
You'll get the invite.
Thanks. Well, thank you so much for being here.
Thank you.
This is Mirror Mirror with Amy Chang. If you want more conversations like this, you can find the full episode on Apple, Spotify, or wherever you listen to podcasts, YouTube, and be sure to follow Mirror Mirror with Amy on Instagram for weekly reflections and double takes. Please don't forget to rate, review, follow, and subscribe to Mirror Mirror wherever you get your podcasts so you never miss an episode. Thanks for examining the world of beauty with me, your host, Amy Chang.